come down and label the two.
If they didn't,
It's irretrievable.
if they've done something.
If let's say they just put mommy's information on the tube,
Okay.
but not the baby's information. But I don't know who am I dealing with.
Yeah, that's true.
Because this ain't mama, this is the baby.
Yeah.
So we need you to come down and label this too.
Okay.
So we allow them to come down and label. I'm sorry, excuse me. The tube.
Okay.
But I make sure they understand that I'm not going to process this tube until you come down here and label it.
Okay.
So I tend to ask for the charge nurse. It gets done. No problem, no harm, no foul. We have some situations where it's an A or a B RH positive mommy.
Okay.
And they haven't labeled it correctly but we never did test them anyway. Well, ma'am, this baby's in the NICU. I need you to come down and label this too. So we have a habit of we check every baby that comes in the door. We check the mommy first to make sure that she has been typed and to make sure of her blood type.
Okay.
And then we, if we need to, we order accordingly.
A what?
We might have to order the testing.
Okay.
So it's understood for us. Our doctors want every baby to come through here to be tested. If mama's RH, if mama's O positive, they want a DAT to be done.
Okay.
If mommy's RH negative, we need to know if baby is RH positive in case she needs Rogaine. So we go ahead and order those tests if we need to. But yeah, normally we don't have any issues with the orders already being placed before they get here, but we are able to order if we need to.
Okay. Without having to wait on that.
Exactly.
Because like you said, it's an irretrievable discuss. Got it.
So if it comes down labeled incorrectly, we're missing information, they can come down and label it. There's a form, the irretrievable form. They can fill out that they are taking responsibility for this.
We keep that form here? You keep the form in the lab, or they have it on the floor?
I think we do keep some, but it's on shared data because we fill it out, and I think it goes to like your manager in QA, I think.
Okay. If that situation occurs, it needs to be documented.
Right.
Okay. So you document it anytime there's a discrepancy and they didn't label it, even if they're coming down to vouch for it, or do you just do it if it's possibly mislabeled or something?
We might write it up as a discrepancy form, but we don't let them label anything other than cord blood. Everything else gonna be recollected.
Yes, that's right.
Yeah. So like, tip recollected.
Okay.
So the cord blood, of course,
And that's when you do that document, the irretrievable specimen document. Got it.
Yeah.
Okay. I have to look for that on the shared drive.
Shit.
Think it's on there.
Shit.